Hi, I'm Georgia. The issue in question is whether or not education that has been requested regarding how to conceive a fifth child should be given to our client, who is a woman of childbearing age. She already has 4 children who have been taken away from her and is currently living in a homeless shelter. I am not going to approach this by stating whether I would or would not provide her with the education on how to conceive a fifth child if I was her nurse. The framework of my argument is based on the theory that yes, she deserves to be educated, but that education needs to primarily address the problems she would face if she chose to have another child at this time. This information would not come from me in an opinionated way, rather in a factually based form of communication that would also express to her that her well-being is my only interest in this situation. It is my opinion that there are few issues with black and white answers. This is a complex situation that likely has much more background information and influential factors that we have not yet considered. Why has she lost her children? Why is she homeless? I think that one of my most important roles as this woman's nurse would be to have her consider those factors before providing her with the information she is requesting. Also, has a mental status examination been done on this patient? What were its results, and is she where she needs to be, or does she need to be transferred to another facility where she would be able to receive more support and services from healthcare professionals? Again, I am not saying that I would not provide her with the information on how to conceive, but that would not be my first priority in this situation. An article in the Stanford Encyclopedia of Philosophy titled "Pregnancy, Birth, and Medicine" discusses an issue that could be relevant to this patient's case. It addresses the issue of incapacity for autonomy and states, quote, "When a patient is decisionally impaired or incapacitated, ethical dilemmas concerning medical decision-making arise. Should the patient be included in decision-making in a limited way to the best of her abilities, or should paternalistic decision-making take over?" End quote. My stance is that providing her with the education on how to conceive another child is taking an action before doing the necessary assessments. I need to know more about her ability to make an informed decision. At this point, with what I know, I would provide education about temporary birth control measures first. This would not be harmful to her, yet having a child at this point in time could be. Something seems to be missing here, because why does she need information about how to conceive a child if she already has 4? Is it that she is more so trying to figure out how she would keep the 5th child, or is she requesting education on how to conceive because she does not have a partner and wants to have a child on her own through a method such as artificial insemination? I would first spend time trying to get to know her better and the reasons behind why she needs this type of education and why she wants to conceive another child considering her present circumstances. Is she lonely? Does she miss the children she lost and is looking for a replacement? I think that there could be other more important educational opportunities here. Temporary birth control measures until some of these issues are figured out, as opposed to long-term birth control, could be an option that I would talk with her about. Maybe she does not understand that there are types of birth control that are not permanent, and she could decide to come off of the birth control to conceive at any time, hopefully when she is more financially stable and can take care of herself. I understand that as a nurse, it is my duty to always abide by the Code of Ethics for Nurses, and under Provision 1, nurses must respect the patient's right to self-determination. Section 4 under Provision 1 states, quote, "Patients have the moral and legal right to determine what will be done with and to their own person, to be given accurate, complete, and understandable information in a manner that facilitates an informed decision, and to be assisted with weighing the benefits, burdens, and available options in their treatment, including the choice of no treatment." This is an important section in the 2015 ANA Code of Ethics for Nurses because it facilitates care that respects the patient's right of autonomy. However, also under Provision 1, Section 2, it is stated that, quote, "Respect for patient decisions does not require that the nurse agree with or support all patient choices. When patient choices are risky or self-destructive, nurses have an obligation to address the behavior and to offer opportunities and resources to modify the behavior or to eradicate the risk." End quote. Given this patient's history of losing her 4 children and currently being homeless, I think that a decision to have another child could be risky and even self-destructive. How would she support her child given her current financial status? What implications would it have on her if her 5th child is also taken away from her? These factors must be considered before supporting or encouraging her to conceive at this time. I believe that this issue could shape the future of nursing practice by reminding us that we need to take the time to get to know our patients. Sometimes they tell us one thing, but after peeling back the layers and talking with them more, we figure out that there is another issue behind the problem that they first present us. Also, it is a delicate balance for nurses to respect the patient's autonomy while also providing them with the education that is in the best interest of their health and safety. The future of nursing can be shaped by figuring out how to do this without inserting our own opinions or moral beliefs about what is right or wrong.